So can you please talk us through how a usual night shift at the hospital is and what you have to do?
A usual night shift at the hospital. I arrive in the morning, start again.
Yeah.
It's a night shift. Okay, I arrive for handover starts at 7:45. We have a general handover at the board for half an hour about all the patients. Then you go to your 5 or 6 patients and you have a handover of them at the bedside. Then the nurses that are on day shift, they'll go home and you just begin your night. So I would introduce myself to my patients if I didn't know them already, see how they are, see if they need anything. We have certain systems that we use. So for drugs, we use a system, EPMA. I'd run through that, make sure any drugs that were given or needed to be given were, and what drugs I will need to give. And then we do 3 drug rounds throughout the night. If just answering call bells if the patients need anything during the night. But on night shifts, if your patients are well, they will sleep. So you just have to do general.
So how do you stay motivated to work when you're really tired and it's 3 a.m?
When you're on a night shift, I think you expect to become tired during the night and you just push through. Night shifts, I normally do 2 or 3. So if I'm in that mindset, that's gone off tangent.
No, don't worry, you can go off on a tangent.
Okay.
Don't worry about it, just keep talking. I know it's difficult because you can't see
Yeah.
me for reassurance, but just keep talking.
Okay.
Just pretend it's Izzy's face or something. So I can ask you the question again.
Okay.
So, and then after you finish, just keep looking at the camera just for 3 seconds. So, how do you stay motivated to work when you're tired and it's 3 a.m?
During night shifts, you expect to become tired, so you just push on. I get my lunch break around 2 o'clock, and sometimes we get an hour and a half, sometimes 2 hours. It depends how busy the ward is. I don't know, coffee, I guess, just talking to your staff. We have things to update during the night, so there's different jobs that you have to do throughout your night, just to keep them busy.
So
really.
Is that how you would generally stay awake?
Yeah, there's nothing special really, to be honest.
And how do you feel when you leave in the morning and see everybody else starting their day?
It depends if it's my last night or not. So if I'm coming back that night, I just feel like I have to go home and go straight to bed, which is kind of boring. It's kind of nice. Once 7 o'clock comes in the morning, I know that that's it. The night shift's nearly over and I will get to go to sleep. It's fine. Go home, go to sleep, come back in.
Do you feel jealous?
That they're starting. I think you're more jealous when you're on a day shift and you see the night shift people going home. I don't know why.
So do you like night shifts?
Night shifts. Do I like night shifts? Yeah, I do like night shifts in a way, because days the ward can feel manic because there's so many people coming and going. There's doctors coming, telling you what needs to be done, what the plan is for the patient. There might be physios, occupational therapists, dietitians. There's so many people coming. Then at night time, there's just a plan and you follow the plan. But the daytime, that's when the plan gets made. So that's the difference, really.
Okay, so how difficult do night shifts make it to carry out normal rituals like shopping, getting food and seeing friends?
How do night shifts... No, anyway. Carrying out rituals while I'm on nights, to be honest, you don't. I might get to see my girlfriend in the morning before I go to sleep. Sometimes she comes over after I have my sleep and in between until I go again. Shopping, I don't go shopping during my night shifts. So I actually eat quite unhealthy during night shifts. I feel like I deserve it, to be honest. That I can eat chocolate during the night because I'm staying awake. It does mess up, but you only do it for 3 nights and then you're maybe off for 4 days, so it kind of is worth it.
And can it be difficult to balance work with a personal life?
At the beginning, balancing work with personal life is a bit of a challenge, but you just get used to it. Anyone that does shift work, I think, will obviously knows the same. You work 12 and a half hours in a day, so that day is gone. You can't really have a normal life during those days, but then you have days off when you have 2 or 3 full days off in a row. So I think the work balance is different. It's different to 9 to 5. It's not your normal work 9 to 5 Monday to Friday, then you have the weekend off. You might work Monday, Tuesday, be off Wednesday, Thursday, Friday, and then work the weekend. So yeah, it's different. You just have to work around it.
Do you like not having to work the 9 to 5? Do you feel like you've escaped the 9 to 5, or do you feel like you're stuck in something worse?
Would I prefer 9 to 5? Do I like... sometimes I think I would prefer 9 to 5, and within nursing there is a 9 to 5 job that could be possible for me to do, but at the moment I think shift work is working for me. Like, it's, you know, it is worth it, doing the long days and working them days and then having your days off. We still work the normal 37.5 hour week. We just work it in a different way.
Okay. Could you describe like the best and worst implications of working night shifts? So what's the best thing, and then perhaps what we talked about earlier, like what's the main fear you have when you work the night shifts?
The best and worst thing about working night shifts. Best thing, as I said earlier, is there's a plan. You don't have to go looking for doctors or anyone to see what's going on. You know what the plan is for patients. It's just not as hectic as a day shift. And then the worst has to be, it's just so unnatural to stay awake all night and then sleep during the day. And I think it's even harder during the summer when it's bright outside, it's sunny, and you're trying to sleep. Sometimes it's impossible. So yeah, I think changing your sleeping regime is definitely the worst part.
And how about, because if you just say about how you work on like a head and neck ward, and you know, because you talked about the fear of blowouts, perhaps you could talk through that a little bit?
So on my ward, it's a surgical ward, but it specialises in head and neck. So nothing to do with brain, no neuro, just head and neck. And it's all oncology, it's mostly cancer. A lot of our patients have cancer of their throat, and we have two main arteries in our throat, the carotid. There is a chance that if their cancer cannot be treated, the cancer may need to be maintained, or maybe they'll need surgery on it, but it can grow and grow and grow, and the carotid artery can burst. And this is a risk in our ward. So I think, I've taken care of these kind of patients before, and during the night you kind of fear in a way that it may happen. And when these things happen, it hasn't happened to me, but I've heard it from my colleagues, the carotid artery bursts, and the blood pumping from your heart, it just goes everywhere at a high speed. So I think that fear is always there during nights. And nights as well, that's the other thing, there isn't as many people around. And when there isn't, so, it's harder to get doctors and everyone to come when there's these emergencies.
Do you feel like you have a lot of responsibility?
Well, I think you have a thorough responsibility anyway, especially on my ward. It's an airway ward, and within nursing, within healthcare, airways, that's the first thing. That's the first point of call you go to with any patients, is make sure their airways are patent, because if your airway isn't patent, you're going to die. With my ward, at head and neck, a lot of people have surgeries, they breathe through here, either through a tracheostomy or a laryngectomy through here. And they can get, obviously blocked if they're not taken care of, or if something happens easily enough. So, yeah, that worry is there. It's very acute, high risk ward, but yeah, we're trained to do that work. So.
And how much longer do you think you can work nights?
I don't know. I mean, I probably could do it forever, but I mean, that just, for now, because I'm young, I have no responsibilities, I don't have children, it doesn't really matter to me. When in a few years, if I have children, yeah, it probably would mess up, with different rotas and stuff. I don't know. We'll see. That's a really hard question. I don't know.
Do you have any questions?
Could you describe if there are any maybe health that affects to your personal health, well-being, and relationship with others? I mean, maybe you touched upon that in an earlier question, but if you can describe sort of if there might be any negative effects to your health.
Yeah, doing night shifts does have a negative effect on my health. I don't think health-wise it has, no. I haven't become unwell by doing night shifts. I guess with relationships, my girlfriend, she doesn't work night shifts, so she's obviously asleep at night and awake during the day. Whereas if I'm on a night shift, I just sleep during the day. So obviously that time is taken away from us to spend together. So yeah, we just try and fit it in while I'm on night shifts, either, as I said, in the morning or in the evening. And if not, we just don't see each other for a couple of days, and then we spend the days that I have off together.
Do you find it, just like last question, do you feel like lucky, or do you find it helpful that you have someone who's accommodating of your shift pattern?
Yeah, Izzy is great. She doesn't you know, she would never hate me for working nights. She knows it's part of the job. Her parents are nurses, so she understands. She's grown up with it. I don't think it's anything new to her, you know.
Yeah. Do you enjoy it as a last one?
Do I enjoy nursing?
Yeah.
Yeah, I enjoy nursing. It's great. It's the patient satisfaction is a major thing in nursing, and obviously keeping them safe is the main thing. But then there's satisfaction and them thanking you for, you know, making them feel safe, making them feel okay, happy. If they have queries, you know, you sort it out for them. You get things done for them. You're their advocate. You speak for them. So yeah, I do. I love it.